right, so welcome everyone to our January office hours. So this is our first webinar, office hours webinar for the year. So thank you all for being here. My name is Cristina Hernandez, she, her, ella pronouns, and I'm with the Oregon Health Authority's Community Partner Outreach Program. And so we have kind of a packed agenda for you today. So if we go to the next slide. So just a little bit about what we will be covering today. So we're going to be sharing some new Medicaid benefits for young adults with special healthcare needs. We'll be giving some more updates around OHP Bridge, and then also some general OHP updates. So continuing to inform you about the pandemic unwinding, and then we'll also have some time at the end to share or to collect your feedback around wording with the paper OHP application. And then we'll have some time for discussion and Q&A as well. And then as always, feel free to drop questions in the chat or in the Q&A. We also have that spot at the end. And so with that, I will go ahead and hand it off to our first speaker. So we have Max here to talk about the Young Adults with Special Healthcare Needs program. So Max, take it away.
Thank you, Christina, and hi, everyone. Thank you for welcoming me in this space. I'm happy to come here and present this new Medicaid benefit, which has started to be offered on January 1st and will be a new Medicaid program from now on. It's called the Young Adults with Special Healthcare Needs. I'll refer to it as YSHN now and then. So that's what it means, YSHN. Okay, I'll go next. So a lot of information. I welcome interruptions or chat questions or comments, just to make it less boring. And I really don't mind being stopped, so you can come off mute whenever if you have any questions. I'll do a brief overview of Oregon's 1115 Medicaid waiver, just because that's the umbrella under which YSHN is created and operates. I'll talk about the YSHN program itself and then how it interacts with two other programs. So early and periodic screening, diagnostic, and treatment. It's a mouthful. I'll call it EPSDT. You may have heard about it. And then health-related social needs, HRSN programs. And then talk about what that means for community members, how folks can get enrolled, and then take questions from you. I'll go next. And next, so the 1115 Medicaid waiver is the program under which YSHN was created. So Oregon's 1115 Medicaid waiver really brings a modification. No, you can go back for one. Really brings a modification to the way the Oregon Health Plan works. So OHP is the way that Oregon, the state of Oregon, organizes and manages its Medicaid program, which offers free healthcare coverage to folks who are living on a low income or who may have a family living on a low income, including children, teens, and adults who need that benefit. Okay, I can go next now. So this Medicaid, well, all Medicaid waivers bring some kind of change to the way Medicaid is funded. State Medicaid programs are funded from the federal government. This particular one brings about the following changes. So I'll go next. So this is a lot of information. This is one of those where it's like, you don't have to retain everything. I'll tell you when it's important, but 1115 waiver key changes include expanded Medicaid coverage. So we have continuous eligibility for a lot of people, including folks, children up to the age of 6 and young adults with special healthcare needs. So YSHN enrolled individuals. And continuous enrollment has been extended to cover a 2-year time span. So anybody, for example, who's enrolled in YSHN doesn't have to requalify for 2 years, and they retain their coverage no matter their changes in circumstance within that 2-year period. So that's one thing. And then the other one is that the 1115 waiver leads to expanded Medicaid benefits and services. So this includes the fact that some folks, including YSHN enrolled members, will get access to HRSN benefits. So they will get housing, nutrition, climate supports, outreach and engagement services. if and when needed, they would have to qualify for it. There's a limited set of services that's available for folks who are within 90 days of leaving a carceral setting. You have the inclusion of tribal traditional healing practices, which is very important. And then new appeal system for OHP fee-for-service members, also known as open card members, and expanded service availability for folks. I'll go next. Okay, so let's talk about the Weishin program itself. The program started January 1st of this year. So if you know somebody who is 19 or 20 this year, you can tell them about this program. If they're not OHP enrolled, you can direct them to the one online system. They can go through eligibility determination, and if they meet the criteria to be enrolled in Weishin, they will be enrolled. But what are those criteria? I'll go next. Oh, actually, before I talk about the criteria, just a general thought about why this program is important. So in Oregon, 1 in 5 children under the age of 18 is considered to have a special healthcare needs. Currently, when folks turn 18 and beyond, they lose a certain level of coverage because they're considered adults, and it used to be that their coverage level would be like, yep, you're an adult, go ahead and just find your way through the system. They would lose very important access to services that they used to get in pediatric settings. So this program, Weishin, allows for a transition period where folks are able to transition from pediatric level of coverage for their healthcare needs to adult level coverage, which is considered when they reach the age of 26. So it's really a nice buffer period where folks get expanded coverage. All right, I'll go next. Just a reminder, feel free to interrupt me or ask questions in the chat. I know I'm going fast, and that's because I have a lot to cover, but I'm happy to slow down if that helps as well. All right. Weishin members will be considered folks, young adults, right, who are 19 through 25. So this year, because this program is so new, we're only enrolling 19 and 20-year-olds, but when they're enrolled, they keep their eligibility if their circumstances remain the same until they turn 26. So 19 through 25 are covered. They are considered folks who are living with a health need that results from either a physical, intellectual, or developmental disability, some kind of long-standing medical condition, or a mental health condition, a substance use condition, or a neurodevelopmental condition. All right, I'll go next. To qualify for the program, folks have to be within what is considered 205% of the federal poverty level. Whenever I say this, people are like, what does that mean? And what are the amounts that are considered to be within that level? So this table shows you on the left hand, family size, and on the right hand, the accompanying level of monthly income that would be considered within that bracket. So you have 1 through 4. A larger table is available in our rules as well as on our website. The link to the website is at the end of this presentation. So hang on, I will show you what it is. If you'd like to know what it would be like for someone who wants to qualify if they're within a family size of more than 4.
On that note, we're in the
Yeah.
process of updating the one for community partners specifically that will be added. It may be at the same time as we have the 2025 income update for all these programs at this point. That one's being held up at the moment, but it's on the way.
Yeah.
The one he's linking to is intended for workers, and that's your best bet in the meantime.
Awesome. Thank you. So yeah, that added information will be available, but here is a nice little introduction for folks who want to know what that means in terms of income level. Thanks, Sean. I'll go next. Like I said, this year only 19 and 20-year-olds will be eligible to enroll if they meet the age requirement, the health condition requirement, as well as the income requirement. They keep their eligibility, no questions asked, for 2 years, and then every 2 years they go through a redetermination process until they turn 26, where that's the age out age for the program. The intent, and I hope that that's my next slide. You can go next. Not yet, but the intent is to expand that program, and I will show you how that happens a little bit later, and not too long. I just want to say a couple of words about what difference this program makes. So in Waishin, right, folks who are, let's say, 19 and 20 last year in 2024 wouldn't have qualified for this level of coverage if they were above 138% of the federal poverty level. They would receive EPSDT, so that expanded level of coverage and enhanced vision and dental benefits, but that would end at 21. So what Waishin does, it increases the income limit that helps someone qualify for OHP benefits to 205% FPL, as I showed you in the table. And then what it does, it expands how long somebody can keep comprehensive levels of coverage. So EPSDT, enhanced vision and dental benefits, they keep it until they turn 26 instead of losing it at 21. So that's quite a few years of added expanded benefit coverage if they're enrolled within Waishin. All right, I'll go next.
Since our
Yeah,
next
go
topic is the OHP bridge, I just wanted to add a little clarification on there that this is using a monthly income standard as opposed to bridge using an annual income standard at the 200% poverty level for most of these other members. There is still that benefit difference, though, where they get access to the health-related social needs, which is one of the few exceptions where OHP Bridge is different from that. So they're still getting these extra benefits here, but wanted to talk through that overlap since we got the other topics that are coming up.
Yeah, and then the
Yeah.
other one, because I know that that was actually something that came up during our training that we did for partners, but the other difference besides the long-term care services, HRSN benefits, and then the 2 years of continuous eligibility. So those are kind of some of the main differences between this program and Bridge. And sorry, Max, I'll let you take over again.
No worries. And then I'll let you peek behind the scenes. I think programmatically, my own program, so I am having conversations with folks who lead policy development and implementation for the Bridge program to see how we can coordinate. I can't say more than that, okay? Otherwise, I will be liable. But there's some level of coordination going on behind the scenes. Nothing that you will see this year, but I just wanted to say that there is some level of coordination happening in the back end. All right, I'm ready to go next. All right, so this is to show you how this program will expand over the years, because I did say that, OHP members will be considered potential Waishin members if they're between 19 and 26, but you will realize that this year we're not enrolling everyone in that age bracket. I know, we wish it was the case, but the plan is to incrementally increase access to this program. So in 2025, 19 and 20-year-olds who meet all other eligibility criteria will enroll as Waishin. And actually, the way I understand it, so far 15,000 people have already enrolled, and we're waiting for 30,000 plus more people to respond to our request for information if they would like to enroll. Next year, we will expand that possibility for enrollment to one more age bracket, so 19 through 21. The year after, adding the 22-year-olds until full implementation by 2030, where anybody who's between 19 and 26 or who's 19 through 25 will be able to get assessed and enroll in the program if they meet the eligibility criteria. So a little bit of an incremental roll out. It's sometimes difficult for us to communicate how this happens, but I'm hoping it makes sense here. If you want more detail or you want me to talk to you through it, happy to provide more information, but just wanted to show you how it happens. All right, ready to go next. All right, next again. So what is EPSDT? Again, it stands for Early and Periodic Screening, Diagnostic, and Treatment. What it is a federally required benefit, or I want to call it level of healthcare coverage. So it's complete healthcare services for children and youth. Up until this year, right, it used to end at 21, but for folks or OHP members enrolled in Wyschen, it ends at 26. So folks will keep comprehensive health coverage until they turn 26, as long as they're enrolled in OHP as a Wyschen member. I'll go next. So EPSD requires coverage of services by OHP to cover all medically necessary and appropriate services. So medically necessary means that the treatment is required to either prevent, diagnose, treat a condition or support growth and participation in school and work. And medically appropriate means that the treatment is safe and effective. So as long as somebody needs a level of health service and it's safe and effective for them and it supports them, that service is covered. Currently administered to children, youth, and folks under the age of 21. And then now, because Wyschen is a program, also extended to Wyschen members. So what that means is somebody who's 20 this year and enrolls in Wyschen or gets enrolled through the one online system into Wyschen will not lose their EPSDT once they turn 21 this year. So that's a very, very important update because folks will maintain the same level of coverage once they are enrolled as a Wyschen member. Right.
Particularly important if they have rarer treatments or services or medical equipment needs that aren't covered through OHP's benefits for adults. That's going to be one of the main advantages of getting Wyschen for a lot of these people. So something to focus on.
Yeah, medical equipment, medical transportation, mental health needs, right? A lot of folks have that. Or you know, physical health needs and the other one, folks are living with either intellectual disability or some kind of developmental disability. All of that is covered comprehensively as long as folks are enrolled in this program and get EPSDT. All right, I'll go next. So HRSN, I'll go next again. For folks who don't remember, stands for Health-Related Social Needs. It's a benefit that encompasses supports in the realm of housing, nutrition, equipment to stay healthy during extreme weather in the winter, very relevant, but also in the summer, right? When you think of wildfire season and sometimes poor air quality that results from that, and then outreach and engagement. Wyschen members are required to be screened for HRSN needs at least once a year. And if they qualify and if they report a need, that need is covered through the HRSN program. So there's some coordination being done there. Wyschen doesn't administer HRSN, but Wyschen obviously shares information about member needs, and those needs get fulfilled through the HRSN programs. I can answer a limited amount of information about HRSN. I'm not the expert, but I'm always happy to provide more information about HRSN or direct you to the right people if that is. I know sometimes there's a lot of interest in HRSN benefits. All right,
I'll have them come to speak about housing to this group, and we'll do so again about food in the next one.
Absolutely. All right, that's good to get. That's good to hear because I'm not the expert, but I was like folks to have the right information. All right, what changes for community members? I'll go next. I already mentioned, so this, I'm gonna have to change the slide because this used to be our prediction, but this is now reality. Over 16,000 members are now currently enrolled in Wyschen. We're waiting for information on another 30,000 people, and over 2,500 people qualify for Wyschen because ODDS refers them because they have intellectual or developmental disability needs. So if you know someone who's 19 or 20, or you work with a community that serves young adults, or you're a caregiver, or you know people who might benefit from this program, really spread the word. It doesn't help. It doesn't hurt for folks to hear about this. If they're current OHP members, chances are they've been enrolled automatically if they qualify. But if they're not on OHP, they can basically apply and qualify if they meet the requirements for enrollment in this program. So let people know about it. Why shouldn't? It's hard to say, but you know, you get used to it. All right, I'll go next. So how do we enroll folks? I'll go next. This year, so obviously I explained how it'll change every year. This year, somebody needs to be 19 or 20, be under 205% of the federal poverty level, and meet one of these pathways. So pathways 1, 2, and 3 is for folks who were on OHP or are on OHP and will turn 19 this year. So they either have one or more complex chronic medical condition in their profile, right? Recognized through one, a mental health condition, substance use disorder, or neurodevelopmental condition that was diagnosed and that they had a previous claim for. So the system recognizes that. And as long as they meet the other qualifying criteria, they're enrolled in the program. We get referrals from ODDS for intellectual or developmental disability needs. So folks are also automatically enrolled by the one system once that data is shared with us, as long as folks have agreed to it. And so pathway number 4 is for folks who are new to OHP altogether, and they go through the One Online system. The One Online administers obviously the basic questionnaire as to what you need to qualify for OHP, but they also, in addition, if they're within the age bracket, the income bracket, they get a screening questionnaire to assess for their WISHN eligibility, and the questionnaire is made up of 6 questions, and if folks answer positive to 2 questions out of 6, they're considered WISHN, the criteria is met, and they are enrolled in the program by One Online. All right, I'm going to pause a little bit. I have a question in the chat, and I want to address it before I keep going. So someone is services coordinator for IDD services. How could I have my clients check if they've been automatically enrolled? Someone who's automatically enrolled should have received a letter from One Online to, one, confirm their overall OHP enrollment, and also tell them in that same packet that they've been enrolled in WISHN. So that's the simple of it. For someone who's completely new to OHP and they had just applied and they don't know which program they're part of, again, they should receive a letter in the mail or some kind of official email saying, hey, you've been enrolled in OHP. These are the programs that you have access to. For IDD specifically, that's what I can think of. For folks who were on OHP and they're trying to understand if they have been enrolled, if they will be enrolled, the One Online system should send you a notice that you qualify for this program and that you will be enrolled within 3 months of you turning 19. And you should be automatically enrolled once you turn 19, and there's no gap or whatever. You know, let's say it took a little while for you to get the letter, you're still enrolled if you meet the qualifying criteria. All right, Sophia, I hope, yeah, go ahead.
We're also in the process of updating the One Online dashboard display. So the main dashboard, when you log into the one system, will show that, though it doesn't currently, that we don't have a timeline for when that'll be exactly implemented, but it's coming soon.
Okay. Awesome. Thank you for the update and the detail here, Sean. Sophia, I hope that answers your question. If you have any follow-ups, let me know. All right, I'll go next. I just talked about this, you know, somebody goes to the One Online, or by the way, the application is also, the paper application also includes a WISHN screener. It's available in multiple languages. From what I understand, it's 6 languages other than English. So let me try this one. Spanish, simplified Chinese, Russian, Somali, Arabic, and I'm blanking on the 6th one, but the link to our website will have that last one that I just forgot. I'm sorry for that last language. All right, I'll go next. Yeah, so we want to hear from you. If you have any questions, let me know. Again, off mute is fine, but if that's not, yes, Vietnamese. Thank you. Yes, yes, yes. How did you know this? And it's my program. All right. Thank you, James. If you have any questions, come off mute. I'm happy to respond, but the chat is fine as well. So while I wait for you to ask questions, I think it's okay to go next. And next again, because I'll take your questions, but I just wanted to display so we have a web page, so feel free to consult it. We have some information available, like videos on social media for folks who are interacting with young adults. It could be easier to share videos than it is to share like written material. We have a Weixin 2-pager for CCOs and partners. We have a provider packet as well if you want to let your provider know that you're a Weixin member and what they can do if you're trying to get access services because you're part of Weixin, and a member frequently asked questions page. The email is listed here. All right. I'm done with my resource plugs. There's more, but this is your time. Feel free to ask any questions. Yeah, do you have any questions? I have about 4 minutes. Sophia, you're
So
on mute. Yeah, I can hear you.
So, yeah, if you're trying to talk, we still can't hear you.
I think Sophia's typing.
Okay.
Yeah.
Well, Sophia types, I did want to do a plug for if you're a community partner, like an OHP certified assister. CPAP did do a training about the Weixin, and it has the questions and like what the questions look like in the one system. So we did take adapted a lot of the information that Max's team had developed and worked with our policy teams also to get that information out to you. So it also links to a lot of the resources. So there's links here to our recordings on group site. It's available in English and Spanish, and then the slides are there too.
Yeah. Sophia, your question is about how this program differs from long-term care services, right? So the way I understand it is that certain long-term care services will be available for OHP members enrolled in Weixin, but not all services. And I don't know the breakdown. I can get that information for you. It'll take me like a day or two. If you want to like a breakdown of services, the short answer is some services are covered, but not all.
we can get that in the post meeting email. If we can get that in that timeline, that'll work.
Okay. All right. Any other questions? Awesome. Sean, Christina, thank you for having me. I'm happy to send other materials, responses, asynchronous responses to any questions or comments. Otherwise, thank you. I hope this was helpful. Please tell young adults about this, especially if they're 19 or 20 or even 18, about to turn 19, because this could be a game changer for folks who need it. All right. Thank you so much.
Thank you, Max. So if you have any questions, feel free. I mean, we'll have more time at the end. Also, if there's any other questions, feel free to drop them in the chat or to put them in the Q&A. And then for those of you that are community partners, you can also reach out to your regional outreach coordinator. We can also, if you think of something later on. And then with that, Sean, I will hand it off to you for our OHP Bridge section.
Alrighty. Thanks so much. My name is Sean McAnulty. I'm OHP's Member Communications Coordinator, if we haven't been introduced before. Alrighty, so we're going to head into some OHP Bridge updates. We referenced it briefly earlier on in the presentation, but OHP Bridge is a new benefit for adults with higher income limits than were previously allowed on OHP. They can have income up to 200% of the poverty level using an annual standard for most members, which is a bit different than the 205% monthly standard that Wyschen was using. So a little bit of a difference there, but very similar income limits between the two. OHP Bridge is limited to adults 19 to 64. So once they get eligible for Medicare at 65, they're no longer eligible for Bridge. They also cannot have access to other health coverage, like affordable coverage through employer or through Medicare. OHP Bridge also has the same eligible citizenship and immigration status requirements as the marketplace. Benefits-wise, though, it is basically the same as OHP Plus, with the exceptions of it not having long-term services and supports or health-related social needs, so the climate, food, and housing benefits. Having Wyschen, for instance, if you're in the age range to qualify for Wyschen instead of OHP Bridge, gets you that upgrade to health-related social needs and long-term service access. So there's some benefit differences there that are important to highlight between those two. It also has those different rules like 2-year renewals and whatnot that are beneficial protections. So OHP Bridge, though, is free coverage without copays or costs. It's your standard OHP benefit package with the 2 exceptions we mentioned. Really going to be helpful in expanding coverage to more people that way. So over from OHP to OHP Bridge. We've also been taking applications from the uninsured since then, though right now, at least during open enrollment season, a lot more people moving from the marketplace plans. So folks on marketplace plans are able to keep their marketplace plans for up to 2 more years if they don't make any changes to their account. That means they need to auto-enroll back into the same plan on their marketplace plan and not update anything like income, address, things like that. If they have updates to make to income and address, the system is going to refer them over to OHP Bridge, and they do need to make those updates if they have them. But if nothing has changed at all, they could keep their plan for up to 2 years there. Once they get approved, they're also not going to get automatically terminated off of their marketplace plan. They're going to need to go back and tell their marketplace plan that they are approved for OHP. So that's another step we want to make sure members know to do when they get approved for either OHP or OHP Bridge after they've been sent from the marketplace. We are in the process of adding some language to the notices that will advise that on any case that's been sent over from the marketplace, but it's going to be a few months before that goes live, unfortunately. We've also got some new guidance about applications referred over from the marketplace. There's a member-facing web page we've got up that you can view at your own leisure about transitioning from marketplace to OHP. But we wanted to really speak to this situation and the folks who, when they update their marketplace application, the marketplace is going to tell them they may be eligible for Medicaid, Oregon Health Plan based on this month's household income of whatever they entered. We're sending this information to your state agency. That does not necessarily convince everyone that they've actually applied for OHP and they're not necessarily aware of what that means. We really wanted to speak to that situation and know what to do after that. On the partner side, one of the things that you can do for clients in this situation is help them expedite their applications if they've got any sort of urgent medical need. Knowing that OHP takes up to 45 days to process is not explained in that marketplace side of the process, so just setting that expectation is helpful. But OHP Bridge start dates are specifically based on the date that the application is processed, not when it's submitted. That is unlike a lot of our other programs and marketplace applications generally. Expediting that application so they get processed before the 15th of the month will get them coverage on the 1st of the month, if the next month if they qualify. So if you have someone who is urgently needing to continue coverage and is going to be eligible for OHP Bridge, has been referred over there, letting us know that that application is urgent can be really helpful. Specifically, if you are running into workers who are unable to find an application, telling the worker to commit to do a task inquiry search is the difference between them finding it. Sometimes if they perform a quick search, that would be a reason why they couldn't find an application referred from the marketplace. If you're having any difficulty there, asking them to talk to their lead or to find out how to find those through the task inquiries instead. Those applications that are referred from the marketplace are findable, and we want to get them processed as soon as possible so people don't go without a gap in coverage or anything if they applied for the marketplace initially. Other updates in the OHP Bridge world, right before our meeting last month, so we didn't have time to put this to writing last time, there was a update on the court case that is currently hearing a challenge to the expansion of OHP Bridge and marketplace benefits to DACA enrollees and other people with non-citizen status that happened back in November. So there was a court challenge to that. it was not blocked in all states prior to implementing it on November 1st. The court did then block it in certain states that are suing over this. Oregon is not one of those states, so Oregon remains unaffected. Enrollment is still open to people with DACA status in Oregon. If there is any future court decision that were to overturn this new rule or anything, we would communicate with affected members at that point. But at this point, we really want people accessing the benefits, signing up while they're eligible, and using those benefits. That's going to be helpful to address any medical needs that they have and set themselves better up long term. There's no penalties for coverage being, if you get coverage through the rules as they stand, that is totally acceptable. There's no penalties for accessing the coverage that you're eligible for while the rules stand as they do. So we really want people to be doing so. We will be talking about public charge in a future session of this meeting, but neither OHP Bridge or OHP or the marketplace benefits are going to be public charge in any or affect your immigration status there. So we want to reassure those folks as well, but we'll have a focus session on that in the near future. Alrighty, and we also take incoming questions from partners and answer those through this process every month. We did have one come in this month about whether OHP Bridge covers C-sections. As does OHP. OHP Bridge does cover C-sections. There are only those two benefit differences we covered earlier, where it does not cover long-term services and supports like being in an institutional care setting, nursing home, something like that. And the new housing, climate, and nutrition benefits known as health-related social needs. Those are the only two benefit differences there. OHP Bridge absolutely covers all the pregnancy and prenatal care. It is uncommon for folks who are pregnant to end up on OHP Bridge because the Medicaid rules count the pregnancy as an extra member of the household. Most people, when they report a pregnancy to us, would move from OHP Bridge to full OHP, which gets them some additional benefits, as we mentioned, as well as the 2-year renewal cycles. But if you are on OHP Bridge at the high end of the income range and remain on OHP Bridge while pregnant, it is absolutely covered. Did we get any questions about OHP Bridge before we move on to other OHP topics?
Don't see any questions about OHP Bridge yet. I did share the links in the chat for the trainings that we had talked about for the YSHN, but I don't see any questions yet. But if anybody has questions, please feel free to unmute.
Otherwise, I'm going to move along to unwinding.
Okay.
So at this point in the pandemic unwinding, we are nearing the completion of the process. We had those initial 10 waves where we sent out starting in April 2023 to members, and then we are wrapping up the final 4 waves that were added after a federal request to update systems. As a reminder, the people who are going through the process right now are much more likely to be either over 65 or have a disability. That's based on the Oregon Supplemental Income Program medical members going through renewal in much higher numbers right now. We're also renewing some people who are part of that specific request to have the system updated to look at whether or not somebody should have to respond to renewal on an individual basis rather than a household basis. There's some other people in that group, but the Oregon Supplemental Income Program folks are the larger group, and there's a lot of folks in that group that are on Medicare or otherwise have disabilities that we want to make sure have extra support. So at this point in the unwinding process, we are at 99.6% complete. We are basically done with about 5,000 members or so outstanding currently, just over, I think it's about 5,250. Out of those, 80% are keeping benefits, 2.7% have had a benefit reduction, and 17.2% have had benefits end. That is over the whole unwinding process to date. When we look at it just on outcomes since June, we do see that the people within that age and disability group especially are driving a lower renewal rate recently. Only 60% of people are keeping the same benefit. 20% of them are having that benefit reduction category. That usually means going from full OHP to just a Medicare savings program, where we're still providing them some sort of benefit that helps pay Medicare costs, but they're not retaining their full OHP benefits and are losing dental and HRSN and things like that. In this group since June, you can actually see that the benefit reductions, despite being a pretty tiny slice of the overall population, are actually the second most common experience, a bit higher than the benefits ending result. We've been hearing some concerns lately about the different outcomes between those two charts, essentially. The higher closure rates for adults and people with disabilities are essentially driven by the different eligibility rules that apply to these programs once you have Medicare as well. Unless you qualify for long-term services or a program called Employed Persons with Disabilities, unless you're in one of those two groups to qualify for those, in general, the income limit goes down for most people from 1,732 for adults without Medicare down to the mid 900s per month. So there's a significant drop there that is driving the difference in outcomes, though the income limits for Medicare savings programs do go a bit higher, and that results in the benefit reduction category being so much more common. So when you encounter someone who's losing benefits right now, especially if they have Medicare as well, the first thing we want to do for basically anyone is to review the notice and make sure it's accurate. All the information we're making the decision on is accurate. If anything has changed, report those changes. If you disagree with a decision, request a hearing. So if someone hasn't been screened for long-term care before, it is often helpful to do so at this time. That way you can potentially get access to benefits through a higher income limit. But trying to make sure that reviewing that notice, making sure all the information we have on there is correct is really the first stage there. If they're specifically being found over resource limits, financial resource limits start to apply as well once you're aged or disabled. Those members, we really want to connect with an eligibility worker to talk through their options there. Members might have options to remain on benefits despite being over the resource limits. There are financial moves some members can take to do so, but we really want them to talk with the eligibility worker first to make sure that they're doing so in an allowable manner that doesn't disqualify them in the future. So talk to the eligibility worker is really the guidance we want you giving on that. If somebody is correctly losing coverage under those previously discussed items on the slide, once that happens, we want them to go over to the Senior Health Insurance Benefits Assistance Program or a Medicare agent to get help weighing all the different Medicare options. When you're on Medicare, you've got the option to buy Medicare Advantage plans or a Medigap or a supplement plan and Part D plans. All that sort of decision making, we want them to get over to a professional help for, essentially. These are the kind of the equivalent of assisters, but on the Medicare side of things. Specifically within 63 days, if possible, that's the shortest of the various windows that apply to them. But within 63 days, if they can get over to a Medicare counselor after losing OHP, that is their window to make all of their Medicare decisions and set themselves best up for being on Medicare going forward. Other key point there is that if they are in that benefit reduction category, which is really common right now, we want to make sure that they understand which Medicare savings program they're on. There's kind of two levels of that program. QMB is the one that provides both their Medicare Part B premiums, so it pays them $170 a month towards Medicare that would otherwise be taken out of their check. In addition to those premium costs, QMB provides secondary coverage as well, which is pays the rest of their bills after Medicare is paid. So it gets them to 100% of their medical covered services paid, but just follows Medicare rules there. That function right there is pretty duplicative of a Medigap plan, so they don't necessarily need to go to Sheba and weigh all their options if they're in that situation. They have the option to, but in that case, QMB is providing secondary Medicaid coverage that's pretty duplicative of a Medigap plan. Where we really want folks going over to Sheba and definitely like prioritize it in this case is if someone's only on the Part B premiums only level plans, known as SMB or SMF in our eligibility notices. But if they're only getting the Part B premiums paid, that does not provide any coverage. It is just paying the $170 a month, which is helpful. It's about a 10% income increase for anyone who qualifies for the program, but we really want them to get over to talk to the professionals and make sure that their Medicare is set up to cover their full bills fully and give them access to medications and all that sort of stuff. So main direction there is to get people over to the Senior Health Insurance Benefits Counselors. This can be found in the same OregonHealthcare.gov / Get Help Locator tool that you can use to find assisters. If you use the Medicare option in there, that's it's going to send you to. Otherwise, other big news in unwinding this month is that essentially unwinding is wrapping up in February. So in March 2025, we will be back to fully normal rules and timelines for renewals. I think that's the big takeaway from this slide. Unless we have any other questions on unwinding, which I haven't seen pop up yet, I'm going to move along to some feedback on the paper application we're going to be taking.
Yeah, I don't see any questions yet, but again, feel free to keep to unmute or to drop them in the chat or in the Q&A.
So as Max referenced earlier, there have been a bunch of changes adding things like Wyshn to the system recently, and we also need to go back and update the paper application to align with the one system and all the changes that have been happening there. That also gives us a general opportunity to revisit the wording of questions on the application, both in the one system and the paper application. So I think the general question we'd love feedback on are what questions are confusing for your clients, and if you have ideas on how to improve them, we'd love to hear it from you. Scope of this is mostly limited to wording, so we're not going to make drastic changes to one system functionality, but we have capacity to reword questions on both sides. We do want these two to the paper and one system application to more or less align with each other. In some cases, it might be reasons for it not to, but we have the capacity to do wording updates on both sides of things. So don't limit your feedback to one specific thing. We're happy to hear those ideas, but that's mostly the scope of this update project here. Got my email on screen if you want me to send me any feedback afterwards. We're looking for that through all channels here. Just upfront expectation setting. It's going to take us many months to get this done. Once we have a complete draft ready to go, then it goes through a several month process of reviews with various agencies and the federal government. So it's going to be a late into 2025, or at least middle of 2025 process before we see anything out of this. And we're also going to need to, as I mentioned, stay within limited scope. We can't do more than a minimal amount of coding change to the one system to make any changes here. So adding entirely new questions or drastically reordering things or something might be out of scope for this project. Might be worth considering down the road in 2026 or something like that. But for this short run update, mostly wording. A bunch of things that are coming with that. There is a race, ethnicity, language and disability, and sexual orientation and gender identity screen changes coming up in March. We'll be sharing more information about those in the February collaboratives and this meeting in February. But once those changes happen to the one system, we're going to want to align the paper application to match those. So that'll be one major area that gets revamped. We're also adding in the new questions, and the Wyshn screener currently is going to be as a separate insert. We're going to get that converted to an addendum in the same way as, or appendix, the same way the long-term care screenings and things like that are currently as an appendix on the end of the application. So it's good. The Wyshn questions are going to get integrated better into the application itself, and then it's going to have its own screening page at the end that you go and use if you answer yes to certain questions. So they'll be adding that into the flow as well. Another major update category is new questions that will allow for applying for just contraceptive care benefits, either through this application or through an entirely standalone process. That is a new program that provides reproductive care access that needs to be accessible either through this application or separately from it. So we need to add some notation about that. Generally, we're also wanting to make sure that this packet is more representative of all our programs across the board, but particularly on the long-term care services, the long-term services and support side of things, where we've got a lot of services that the current question phrasing may only be recognizable to people who need the higher levels of services like institutional care and may not recognize that in-home care worker might be beneficial for them, or intellectual disabilities supports are part of this question as well. So we're trying to make that more representative of all the programs and obvious to folks too. Other big category is going to be a suite of changes to the alternate format section. For instance, we are currently still offering floppy disks and cassette tapes to people in text formats, which will actually be updated to an audio recording, and the different options in there will specify audio tape, USB audio tape versus text and things like that. So there's going to be a few new options coming through there, as well as clarifying the ones that are in there as well and retiring some of the archaic ones. So with that, I'm going to move on to some of the more direct questions to the group ones. Kind of as I mentioned, trying to make things more representative of all programs. Right now, this first page of the application currently says application for Oregon Health Plan benefits. It's probably worth keeping the logo and that general title, but we also wanted to add in some subheader language such as also use this application to apply for other medical benefits, including long-term services and supports, Medicare savings programs, OHP Bridge, OHP dental only programs, and contraceptive care. Are there things that this would raise as concerns or other programs we would want to hear on this? Does this increase too much confusion adding these to the list? Or we would love to hear counter opinions to all these things, but we're showing off a little bit of the language we've got in the works here. Otherwise, we'll keep moving along and let people express thoughts at any point along the way. Other questions we got for the group were, how can we reroute people who need to report a change to easier paths to do so? It's pretty common to get these packets filled out as just someone trying to report an address change or income change, and they end up going through the work of fully reporting the packet. Another thing we wanted to add on that first page is potentially some language that says if you already have benefits and need to report a change, you can do so via the routes to get help. That should be fairly boilerplate, so I won't read it out. Would that be effective in rerouting folks in your mind and save folks work? This is our best stab at the at it at the moment, but one of the other things we were trying to think of is how can we save people from using this if it's not the best route to get what they need to done. Other things we're thinking of are, would language clarifying what to do if you do not have an address be helpful to household members, specifically talking about the CCO assignment. I'm not sure if this fully covers us, but the current thought is that adding some language about that in addition to needing where you spend most of your time, we're looking for where you receive most of your medical care. You often hear some confusion from members about that particular point. Would that be a helpful clarification for us? Or are there better ways to approach this? We would love your feedback on any of these ideas, whether that's in this meeting or through email later, or however you want to get that to us. Throwing this out there as brainstorming starters. Mentioned this one earlier a little bit, but we've also got some changes in the long-term services question, which currently asks if services would be, if you're needing, I'm forgetting the exact word, I'm not going to try to quote it, but there are the questions in there that currently ask you if you have a disability and to answer yes if you need these long-term services and support, if you need help with the tasks of daily living. We wanted to add in some advice that is a rework of the help text that the One system will offer you, but we wanted to put it into the paper application itself. Specifically, answer yes if services like a personal care worker to help you with these tasks in your home, if intellectual developmental disability supports, or if care in a setting like a nursing home would be helpful for you. A worker will contact you for an interview to assess your needs in more detail. Both the explanatory text and the reference to the interview process being next are new features there that folks have internally, at least, and with their previous partner work group feedback session. Sounds like that would be helpful for those. Are there other things that would be helpful to include in there, or things that would make the process easier? One of the things we're really hoping to do with this update is make it clear that this is the question you need to answer yes to if you want to be screened for these things. So making it a little bit, make it stand out to members more as they go through the process.
And I do see a question for you in the chat.
Would you mind reading that out?
Yeah, so it says, do you need to keep answering yes to this question once you have had your original interview?
Yes is the answer. There you maintain that flag on your case as long as you're needing those services. So that triggers the rescreening. We want people to have that. If that situation isn't obvious to people, that's another good thing to call out potentially is keep this question marked yes if you are using these services. Otherwise, moving along. Big question for anyone who speaks another language here or uses the other forms of the application. If there are questions that do not translate well or need to have wording is adjusted, since we have wording and scope for this that can apply to any of the languages that we need to do. So please let us know if there are things that are slightly confusing or aren't worded in a natural way or something. We would love to take the opportunity to do so. We do have community reviewers go over these things, but there's always additional things that we find on every update. So please let us know if you're seeing any of those or there's been something on one of the versions that's been bothering you for a while. Another big area we're kind of working on, and I think this is a little bit more in the investigatory stage, we're still figuring out what's possible here, is trying to adjust the income section to better handle more uncommon situations. Especially the paper application doesn't offer you a lot of opportunity to enter things, and there's a limited number of fields compared to the one system. But the specific thought here at the moment is adding a checkbox to this section on the paper application and a if yes, please provide more information section. That way people could indicate when their income is going to differ from their ongoing income amount in the next month. Specifically, the one system uses the current month and next month's income to make determinations. So if you're expecting to have lower hours due to being off work due to a broken leg or something, we're supposed to take that into account for determinations and wanted to make it easier for folks to do so via the paper application. There are also some other areas in this section, like on the financial resources section. Currently, both the paper application and the one system do not offer a way to name which account type is with. For instance, this bank account is with Wells Fargo. We don't have a place to name the Wells Fargo in the application system, which adds more confusion when it's just account one, account two, sort of things. So hopefully, if one system side of it is feasible, we might be able to add that as well in this section. But if there's other things we would love to see in the income section or ways to make that work better for clients, we would love feedback on that as well. Otherwise, we just wanted to talk through a few different other updates that we're planning. We don't have language to review for each of these yet. We're also working on some language to clarify the child support pursuit requirement question and explaining a little bit more about how that applies to their medical benefits and where to look for more information on that. Other one is adding additional short links to various relevant resources. There's a lot of places where it says to go to benefits.org and .gov or something. We would like to put a more direct short link to the specific resource it's looking for each of those in a bunch of places. Another one is specific to community partners. There is the question that asks if you're working with a community partner to fill out that application. That is almost never something that a member themselves would use that question. It is basically for community partner use only. That has previously been sectioned out as sort of like a stampable section or something like that. We are looking into combining the office use only section where local offices will put a data receipt stamp or data request stamp on it. Seeing if we can integrate the community partner section in with that. That way it's separated from the worker question and off the member facing side of the application, essentially. One of the confusions that came up there was confusion between community partner roles and authorized representative roles. We also wanted to add explanation about what an authorized representative is and why you might want one. This will both give us more space for the authorized representative explanation and separate the community partner role out from that as well. So, and make it clear that it's not something we need or asking members to look for or anything like that. Did we get a question there?
A comment, or just asking if we could add some language around like adding tax dependents that are from another country. So like in the application, because I know that that's been, and it was, Anna said that it's something that's come up and clients have asked when they're trying to add those people if it's a tax dependent. So thank you for that feedback, Anna.
Yeah, I'm immediately curious. I think one of the more feasible ways to do that might be saying to get more information about who to list on this section of the application, go to the application guide, and then listing a section about that sort of guidance in the application guide. Would that be the need to your thought, or is that something that's common enough that we really want it in the application itself, I guess would be my question back on that. But I like the idea. One of those two places it should be. So in addition to the adding explanation of authorized representatives, we also wanted to do some cleanup to the naturalized and derived U.S. citizenship question box. That is currently its own standalone question, which is actually not numbered in the application itself. Like there's a question 24 and a 25, and it's right between the two and not named. Nor does the flow of the questions actually ever direct you to answer it. So it's just someone, partner's feedback, noticed that it is kind of just hanging out there without any other question actually directing you when to answer that one or not. We're looking into reasons that's required and when we actually need that. It might get merged into the citizenship question as well as an addendum. Like if you are a naturalized or derived citizen, please provide this additional information rather than being a separate question out there. But that was a great call out that none of us had noticed over many years. So if there are things like that you have seen, we would love to hear those as well. Then the other change to the immigration status section is adding the DACA checkbox. Like we referenced earlier in the presentation, there's the DACA folks are now eligible for OHP Bridge, and we're going to be adding a box that collects that status because we have not done so before. That's already in the one system, but we need to get that added in on the paper application itself. So that's a lot of what we're planning on there. I would love to hear additional feedback or ideas or things we should be working on. Mostly got this kind of phrased out as this is what we're planning with this whole update. If you have guidance on additional things we should be working on or that you'd like to see, I appreciate everyone who's commented so far and thrown something into the pool there. Love to hear any more you have. We'll put my email in here again.
Thank you, Sean. And I know that we are at time now. So if you had any questions, please feel free to drop them in the chat, or you can reach out to your community, your CPOP regional outreach coordinator, or Sean, if you have any feedback about the application or like wording that you would like to suggest, or any of the other topics that we covered today. So thank you everybody for joining us. We will see you next month, second Tuesday of the month. Before we wrap up, I did want to add something because I don't think we added it to the YSHN training that we did because it didn't come out until like 2 days after we did that. But the questions for screening for the Young Adults with Special Healthcare Needs program. So currently they're not in the paper application. It's a separate standalone addendum document. And so it's available on the form server, and it's document number 781050, and it is available, I believe it's in 13 different languages. So I'm going to put that, just the number here in the chat. That way, if you're working with somebody, most people, if they're being screened for YSHN, they would have received a letter saying, hey, if they're in the age range, they would have received a letter saying, hey, there's this new program and you might be eligible. Here's a screening questionnaire that you can respond to. It was optional to respond, but that was kind of what Max was talking about earlier. But if somebody didn't receive that and they're wanting to, they can actually, they could call in to report that through the one customer service number. You as a community partner can also help them call and talk to an eligibility worker and respond to those questions by phone, or they're also available in the one system. So you should be able to see those notices and help them respond to those notices, or you can even do it as a reported change. And there should be a new reported change function that says reported change in healthcare needs, I believe is what it's called. So anyways, I just wanted you to know about that. But if you're looking for the paper version because you want to see what the questions look like, and you haven't seen them yet in the one system, so it is document 781050, and that's the addendum for the screening questionnaires for the Young Adults with Special Healthcare Needs program.
Which is that same questionnaire we're integrating into the full application as part of the process. So
Yes.
To Mary's question in the one system, I'm not sure if it's possible to upload that as a separate attachment. We can look into that question as well, but there's definitely plans to integrate that better into one down the
Yeah,
road.
I'm assuming like if you see the miscellaneous document upload, you might be able to do it that way, but you can also, like, if you're just trying to, I think if you're going to be in the one system, it might just be easier to do it as a reported change and reported change in, I think it's called the healthcare need is that section, but it'll take you to that part of the application. It'll be right underneath where it asks about if there's anybody needs help with activities of daily living, so that it's added to that section. Okay, and sorry for keeping you over. We'll go ahead and wrap up, but thank you so much for joining us. Thank you to Sean and Max who are here presenting with us, but we will see everybody next month. So take care, everyone. Bye-bye.
Take care.